this video is a controlled video to show you how much you need to get ready, and it's kind of sterile. So everything here is sterile. It's all ready. And once I pop it onto the sterile field, then we'll go ahead and do the catheter change. But always get your kit ready first. So check your blood pressure, do your saturations, and ask your client all the time what they are feeling and how you're feeling.
Fine.
You haven't been though, have you?
No.
So on the trolley there is AD. So if he has AD, where's my finger? In that pot there is nifedipine. I've broke the capsule. It goes under his tongue. That's the only way it works for Ben. So get your sterile pack ready, and this is it. We're gonna go in for a video right now, which is a nightmare for us because, but hopefully I'll get you. Is that going to be in my reading?
Well, you get it in position.
I'm going to get it in right position for you. This is for Ben's staff. I'm going to try and find and show you the stoma. So I'll try and find the stoma for you. So this is the second one we've done. A reinserted one, so it's actually the third one. So always double glove. And my gloves, like I've done it everything, I've got it all ready.
I reckon there's no water in the balloon again.
Well, we'll soon find out. We had a faulty catheter the other week. He's had an infection, which we all know that after an infection, you change the catheter. He's having AD, up, down, up, down, up, down, up, down. So
I'm not having AD yet, because I'm not had a drink.
No. I don't want to give you any drink just yet. I just want to get this out of the way. So I've got some gloves on. And I've got my sterile water here. It's got a segregated there, so you just split it. That stays like that, and you put that ready on your sterile pack. Remember where you put everything because it's a nightmare. And this is the one to deflate the balloon. So I'm going to deflate the balloon now because he's not feeling great. Are you okay?
Feeling fine.
So, as you can see, the tubing is blocked. And to be fair, we had a night bag on and he's had a shower. And this, I'm not going to go in with bladder washes. I'm not poking this back into an infection. So the nozzle here, twist. I'm just going to grab that as quickly as...
How much water have you got?
Hopefully 10 mils, but we haven't. So he's lost some, always losing 2 mils. But it's only been in the body for 2 weeks, 3 weeks, 2 weeks, 2 weeks, 2 weeks. But don't forget, that'll do. But just to make sure, just because that capped off then like that, just cap it back on and just draw back. Look, see, that's the resistance. Once you get that resistance and it can't do no more, that's it, you're out. So that's off. So my dirty pack is here. This is all my dirty stuff, so it will go there and stay there. I'll get the catheter out in a second. I just need to do a blood pressure reading before I do anything. Are you okay?
Yeah.
How are you feeling? Feeling all right, my love?
Yeah.
Oh, fucking shit, come on. So this is obviously a life-threatening condition for all spinal injuries. And obviously, whoops, as you can see there is the kit is all there at the bottom of the bed. This is how I have to do it with the trolley if I want a video for carers, because this way they'll know what to do. And having your rescue meds ready. Rescue med. It's in there, okay? That's 10 milligrams, 10 milligrams of nifedipine. So I'm looking for a reading. I'm not getting one just yet. You all right? You just desatting just a little bit. You just dropped a bit. Do it again. Come on, you little shit. So when I've got this reading, I have one dirty hand and one clean hand. So I'll be my dirty hand is normally my left or right. It doesn't matter whatever I do. You'll see it on video anyway. And always double glove. I mean, sometimes you don't get time for this. This is obviously controlled. So I'm not in a rush to actually, let's turn that. I'm not in a rush because he's not in AD right this second, and his sats are there, brilliant heart rate and stuff. So we're just going to find this now. So hopefully a brilliant reading, and we can get on with this a next change. Come on, are you okay? Because it's going low. 97.49. I'm going to get on with it because he doesn't look right. I want to show you how he doesn't look right. And if you look at his breathing with his intercostal muscles. So I will just get on with this. I will talk. I've just got to get the fuck on with it because that's low. Low as fuck.
Body retaining.
I think you're retaining. Let's have a look. Yeah, he's retaining fluid. So I think he's bypassed, which is fine. It's all in hand. So what you need next is your 2 instiller gels right here. I've already took the nozzles off earlier. The only thing I didn't get ready was my catheter pack, believe it or not, and it's in the bottom of this drawer. So, how you feeling? I need to ask you at all times right now, because the way the readings are.
I know the readings are correct.
I know, they're a bit shit, aren't they? You should have said, and I would have got this done quicker this morning.
Oh, yeah, but I didn't feel like this morning.
Just keep an eye on
it only
the
got
sats.
worse when I got to the toilet.
So, during all this time, he's desatted now to 65, unless that's on the wrong way.
No, I'm messing about with it.
Okay. I'm going to be as quick as I can. And I'll get my second catheter back ready. So you just pop them on that side. There's a bladder wash here, just in case. I've got loads.
You're not going to need that.
Loads and loads of sterilised gloves. So I'll bring my gloves across and I will pop them here. I've already crossed his legs. So actually I'll cross your ankle, not your leg. Cross your ankles together.
Oh, my legs are fine.
I know.
Since you've done that thing.
What?
Since you've done that.
A little rub. So I've rubbed in with a Chinese, stick. It's, yeah. So even the tube is not warm to touch. It's just stayed the same, remained the same. So I am going, because that's all my sterilised stuff, I'm going to get this pad and wrap it up. Sorry I'm taking my time here, but I'm just checking his breathing and everything at the same time, because I believe he's going to wreck. He's going to wreck my sterilised.
I've just messed up.
Don't you worry about the sats monitor. I'm going to do another reading now. Right, so I use the sterilised pad rather than my fingers to do that. And just get a reading and then get him on. Alright?
Yeah.
So it's all segregated. Right, so I have also a day bag and I'm going to attach. So open it without touching. That's all you've got to do. Open your bag, put the bag on. You alright?
Yeah.
Sure?
Yeah.
So I'll pop that there. I'll open up one of them, just one catheter pack for now. If I need the other one, I'll grab it quick. So use your 4 corners. I usually peel back, but I haven't got time to mess about at the moment.
Oh, it's gone red again.
So what you do next is 2 instiller gels. It's finding your medical kit when you've done it. So I just want to make sure I've got everything, bladder wash, everything around me. So it's underneath here. My gloves are here. That is there. That's going to come out. The new one's in. So what I'm going to do with this one, actually, is throw it down the tube, look. And that's all sterilised, so I don't have to touch that. So it'll go in the tube, and it'll go, not that it does a lot, it gives the lubrication for one, And I'll be giving him paracetamol and a bit of ibuprofen after I've done this. So that now goes into there. Your bag, it doesn't really matter because I've got so much sterilised stuff here. I'm about to take it out with the dirty, pop a clean one on and get that back in. I've just got to get my syringe, which is my most important piece, which I've left over there, which is there. There's that much stuff all over this bloody bed. And now I haven't got 2 pairs of hands. So what I'm going to do with that one is I'm going to leave that there.
You mean you've got no help?
I've got no help. But you don't need help to change the catheters anyway.
Only you.
So what I'm going to do is, because he's desatting, I'm going ahead. Then take a nice big breath.
I'm alright, love.
Let's hope this can get shown. The staff. Are you okay?
Yeah.
Alright. I'm lifting it open. It's nice and clean. I'm going to put a bit of gauze there because I think it's going to actually piss out.
Piss out.
I do. So I'm going, the balloon's down. And I'm going for it.
Okay.
Oh man, that wasn't even in.
I did so.
So because my hands are dirty, I don't really give a shit. But there's a kind of a blood clot there. Don't look if you're squirmy.
Told you it weren't in.
But there's something in there, and it's like really hard. So nothing. Oh yeah, nothing would have passed that. No wonder he'd stopped urinating. Yes, I'm slow. I'm slow at doing it, but yes, that was blocked. And I'm slow at doing it because it's got blood and stuff in, and I want to make sure that my son is okay and fit. And
Will this work now?
How you feeling?
Alright, so I should go back to normal then.
Eh?
I should go back to normal.
You tell me how you feel right now and glove off.
Fine.
You feel alright?
I had no idea.
I didn't think you would, nice. Let me just put a different pair of gloves on.
What, before you stick the new one in?
Yeah, I'll get that. I just want one dirty. So my dirty hand is this one. I'm going to do a blood pressure. Are you okay? Yeah.
Even though they'll probably say
Not bothered about the dirty
the
hands.
sats are probably saying nothing.
The sats are going at 58. I don't know why. But you're breathing okay. So I'm not going to go by them sats right now.
Don't, 'cause I'm
So I'll
really
tell you
bad.
what, I'll do you a different sats. So if your machines, if you feel that your machines are failing, make sure you clean the insides of your probes. So this sats probe is going to go on. Yeah, that one will go off now and bling.
This one's
Get away from my glove. Get away from my glove. My one sterilised glove. So I'm just going to put that on. Tell me how you are.
That's more like it.
Let's have a look. This is my sterilised glove. You've got the corners. Let's have a look. 65. So that's 83 your heart rate on that one, but it's fine.
It's better than
My
that.
hands are sweaty as hell.
That one's not as
And this
accurate.
is the most important glove you've got
You
on.
know that. That one's not as accurate.
So
is it?
hands, I normally say to staff, hands together, but I haven't, this is my dirty. There's only many. So this is, oh brilliant, 135, 83, 103. So I'm now ready
Now ready.
to put my arm. Let's get this in. Not sure if anyone can see, but there's actually no urine coming out.
The rent.
None at all.
It's because I've had no drink, don't forget.
Okay. So I can grab this catheter out.
So it lost water then.
It's lost everything.
So it lost
So
loads of
your
water.
dirty hand can touch this. Your clean hand, it doesn't really matter. So I'm opening. I hope this gets to see this. I hope people, like your staff, will be able to get. So go over, turn over to your side a bit more. Stay still, stay still. This is a nightmare because you're too.
I'm too
You're just
what?
gonna pass it tiny, just a tiny amount for a minute. Because he's gonna desat, which he has. You alright? You breathing okay?
Yeah, yeah. God, that gave me loads of bad ideas.
It won't go in.
Why won't it go
I
in?
don't know.
Why won't it go in?
I don't know. I'll measure it in a second. I think I've got it in. Are you
No,
feeling
I think
okay?
you have. Yeah, you've got it. No more AD.
Sure.
Any more?
So I'm holding it for a moment.
Any flow?
because it's sterilised. I've got a mini flow, but what I'm going to do is move him around from side to side while I hold on to the catheter to keep it in place. Hold that arm and come this side for me.
So they're not the sats about.
Don't worry about your sats, but don't let them go off. Okay, go that way. Roll over and I'll show you. So we've got an absolutely clean wound there. And I've actually got some urine, but I'd only say 10 mils if that. Something is giving it a resistance and I don't know why. Maybe we've got something in there like a fucking stone. So this is when you have complications.
What's happening now?
Well, I'm trying
To get it in.
I've got it in.
But you
There's
haven't.
some sort of resistance there.
Is there a resistance?
What I'm going to do is keep you on the bed
Yeah.
and make sure. That's weird. I'll measure it, so I'll show you my measuring trick. Let's get that in. So you're blowing the balloon up with the nozzle.
Oh, have you got it in then?
Shit, I'm gonna have to hold it with
Have
that.
you got it in?
So if you haven't got two sterilised gloves, grab something sterilised. Just hold the catheter by the stoma and grab this. Grab your catheter, wrap it around yourself like this.
I think you've got it in now.
I think that's in, but we're going to check, and I'll show you how to check. Oh shit! I'll check that.
Oh.
Many mistakes are happening today, mate. So because that's come out a little bit, I'm making sure, because it's nice and stuck in, but because I've just lost probably half a mil of water, I'm going to draw it back out and check rather than piss around. Let's see how much I lost then. So drawing it back again, look. Where's that water gone then? We must have faulty catheters, mate.
Well, what the fuck happened?
This is the worst video I've ever done.
What happened
In
then?
28 years. I don't know. We'll soon see. So lock off. Oh no, it's coming. Fucking hell, that shit me up there. Breathe. Nose. Mouth. I just need to make sure I've got 10 mils. Are you having AD? I can't get to that bloody machine.
Yes, I'm having AD.
I thought so. So how many mils have I lost? I know that's in. It's in situ because you can feel it's in.
Did you lose any mils?
I've lost 2 mils. So you get rid of the air.
So what's happening then?
I don't know, mate. I lost that, but that was my mistake.
So have you got to put 10 mils in?
So I need to cap off. And oh fucking hell, what's going on with your catheter?
Why? What's happening?
Nothing.
What's happening?
I don't know, mate. I really don't.
There's something wrong,
know.
isn't there?
Yeah. Let me just get this balloon in and then see. What I'm going to do is put 2 extra mils in that in a minute. But what I want to do is show you that it's in. I've got a beautiful flow. No, I've got no flow yet. I will have a flow.
Well, I've stopped feeling AD.
That's not warm. So I know there's something major wrong there at the moment, which is absolutely
No,
fine.
just let me have a drink.
I can't yet, mate. I want to... So, you have this. So if you turn it to 1 centimetre there, and you turn it onto the 14 there. So you make sure you've got 14.
But then
So,
what beats per minute?
from the whole port, yeah, what's your beats per minute?
It went to 45.
Well, that's shit, isn't it?
Well, yeah.
So this is a little measuring technique to make sure that it's actually in place. So 28. Oh God, my fingers are shit.
It's going back up now, though.
Yeah, I know. That's 28. That's more than 28. That's less than 28. We're going to have to keep an eye on this because it's normally 28. That is not 28. So I am getting a bit pisser.
Well, it's not.
I will get a flow. And I'll make sure I get a flow. This is one of the worst catheter changes I've done for a long, long time. I'm getting pretty pissed off with, well, we've got a lot of crap coming out now. I'm getting pretty pissed off with PPE, faulty bollocks, because some of it is very faulty, and it's still faulty. So there's the catheter change. I'm going to now get rid of my bags. Right, I'm just going to show you on there. Yes, I'll take my sterilised glove off.
At least the sats are
And I'll
alright.
take my dirty glove off. Sorry, we've had a bad few days. We've had a bad week. We've had COVID, whatever you want to fucking call the new COVID that's going around. So I'll have a flow.
Yeah.
So if I bring it this way and give Ben, get him to move his belly around and give him a little massage, we will get it going again. It won't stop. Because you can see, look, his tummy is distended.
Yeah.
This is his distended tummy. He's not telling me the truth, but he's breathing shit right now. I'm going to hang right there and I'm going to take the bloody reading.
You are right.
What?
You're right. About to send it to them.
Oh, it'll go away now. I'll do another reading.
This is the worst, isn't it?
Hopefully. Well, I don't think it showed it online. I'm not online. I don't think it showed your capital change, but I don't really give a shit right now. I'm more cared about getting that reading, moving the camera out of the way, see what I've got. You're breathing shit, is that what you said? You still feel shit? Do you want some oxygen?
Just leave me for a minute.
Do you want a drink?
Yeah, and see what happens.
Okay.
Don't forget.
Do you want your ventilator?
2 meals are missing as well.
I know, I'm going to put the 2 meals back in. Do you need your ventilator? Do you need any rescue med?
No.
I don't think you need rescue med. I think you need to... Okay, you might. 178 over 16 and 107. Right,
that was
you need
due
to be honest with me now.
That was due to the, what do you call it?
What?
That was due to you putting the catheter in.
What? Yeah.
When the AD went ridiculous. The AD's not ridiculous.
So, this, even though you're going to get blood, this here is a stoma. And as you can see, we have flow again. With
I think it's going down
sediments.
Now. My stomach's going down.
So it's quite a lot of sediments that's coming out of that.
I'm glad.
I will attach night bag. And
I feel like everything's coming out now.
You will get a bit of blood. And I'll just touch this. And it's warm-ish. I've got to wait. But I'm just showing you. So this is the mess afterwards. And it is a lot of mess. How are you? You're mostly important here.
Fine.
And this is how long it takes.